Well, as we reported yesterday, the CDC has provided an update about what you can do after you're fully vaccinated. However, local health experts say that we still need to be cautious. KWWO's Diego Hernandez now joins us live from the newsroom with a breakdown of what this new guidance means. Diego.
Well, Abby, the reason it took this long to come out with an update is simply because we needed time to see how the vaccine worked. Now, health experts know the risk of catching and spreading COVID is low after being vaccinated, but it's still a possibility.
Every time we have a new recommendation about COVID, it means we've learned more about the virus and that we are even just one more step close to getting out of this pandemic.
The new CDC guidance isn't a return to normal just yet.
This is for fully vaccinated people in very specific circumstances where there's no additional high risk of transmission.
Those specific situations include indoor gatherings with other fully vaccinated people without social distancing or needing to wear a mask. And if you are fully vaccinated, you can meet with others who are not, as long as they are a part of only one household.
Again, not everyone in the world has been fully vaccinated.
An epidemiologist from Blackhawk County Health, along with Dr. Wellington, says to not forget about staying safe, even with these new recommendations.
If you've been fully immunized and you want to visit with somebody who's at very high risk, who is not immunized, you're still supposed to take all the safety measures.
COVID-19 is still out there, so maintaining those, wearing a mask, social distancing is still critical to the slowing the spread.
And the CDC recommends all safety precautions still be followed when in public, meeting with folks from more than one household, or meeting with anyone who is at an increased risk of catching COVID-19. And that's all even if you have already been fully vaccinated. Abby?
Diego, thank you. And a reminder, you are fully vaccinated 2 weeks after getting your second dose of a 2-dose vaccine like Moderna or Pfizer, or 2 weeks after the single-dose Johnson & Johnson vaccine.